We might get started. Welcome everyone to Remede Wellness Medicine. My name's Kimmy. I'm a clinical nutritionist here and a naturopathic medicine practitioner and a hormone expert. So tonight we're going to talk about one of my very favourite topics that I like to talk about a lot, and that's perimenopause. So are we all here to listen to perimenopause? Yeah, great, excellent. So perimenopause is a fascinating subject. I'm very passionate about it for a number of reasons. I'm there myself. I'm in the zone, and I've found that over many years of clinical experience that we're not really guided through this process. There's this sort of big word of menopause that's out there, and it almost sounds a little bit scary or a little bit unknown and a little bit like our first puberty. So I do call perimenopause our second puberty. Our first puberty that we went through when we were young, there wasn't really too many training manuals or a lot of education. Menopause is often sort of, feels like it's a little bit scary, a little bit like a negative sort of process that we're going to head towards. And like our first puberty, we're not really given any instructions or guiding sort of manuals. And perimenopause itself is a process. It's actually a process of hormonal changes in our body that can take up to 10 to 15 years before we actually hit menopause. And this is often surprising for a lot of people. Menopause is literally one day, which is 1 year after your menstrual cycle stops, after you stop bleeding. Leading up to that, the whole process leading up to that one day, 1 year after your bleeds stop, is the process of perimenopause. So that time frame can be up to 15 years for some people. Not for everyone, some people a couple of years, some people up to 15 years. And during that time, there's a whole bunch of hormonal changes going on in our body. So I'm passionate about it because, yes, I'm going through it myself. I see so many women who just really don't know what's going on. And you might have even seen in that first frame the question, is it my hormones? It's the most common thing that I get asked when people first sit down and talk to me. Is it my hormones? Or I think it's my hormones. That we're not quite sure because we were never really given that manual. A bit like maybe when we had kids, we were never given that manual either. And there's so many different changes that go on during this time. It can feel a bit chaotic. It can feel all over the place, and we're not quite sure if it's connected to our hormones. But we're often sort of given that feeling or that impression that, look, it's just a normal part of being a woman, even though it feels a bit yucky. And I'm quite strong about encouraging so many of my patients to be able to get on top of this, because just because it's common, so just because a lot of these changes are happening, a lot of these symptoms are occurring, it doesn't mean that it's normal. It doesn't have to be your normal, okay? We can actually manage this process and it can actually be quite comfortable. The other reason why I'm very passionate about this is that it is a very, very sensitive time when it comes to our health. So for women, all of these hormonal changes that are happening, there's the whole bunch of symptoms that go on at this point in time, which I will go through tonight. But even if you're not experiencing any symptoms, there is a lot of changes going on within your body. So it's a very sensitive and critical time for your health. It's an opportunity to put in place a lot of preventative measures and really set up your future health. One of the other reasons why I'm super passionate about this area is it's such a critical window when it comes to women's health. There's a lot of changes going on at this time in our body. So even if we're not experiencing some of the debilitating symptoms, and I'll go through them separately, it does mean that the changes that are going on within our body are actually critical. They're particularly sensitive, and if we don't address them or they go unmanaged, they can be leading to other issues post-menopause. So that's probably the most important reason why we take a close look at what's going on at this point in time. So I'll start with, well, menopause, like I explained before, is literally 1 day, 1 year after your bleeds stop, okay? Before that is perimenopause, after that is postmenopause. So tonight we'll focus on the perimenopause, but menopause really, it officially kicks in when those ovaries produce so little estrogen that there's no more eggs being produced, okay? So that's why the bleeds actually stop. It's not a single event, it's a process, and what I want to talk about is the hormones that change throughout that process. But realistically, and I'll just throw in a little fun fact, we are the only animals or creatures that actually get to live past menopause. So in every other species, the woman is redundant at the point of no longer being able to reproduce. Okay, that's the end of their life. The great thing about being human is that once we get to that point, we can have up to about 4 decades of life without a monthly cycle. I think that's actually quite exciting. So if we manage it properly. So what happens in perimenopause? So when we went through our first puberty when we were young, our estrogen came in, and then what happened was our body was slowly making progesterone. Okay? Progesterone and estrogen are the 2 key female hormones for reproduction. There are other hormones involved in that process, but they're the big buddies. When we go through our second puberty, so perimenopause, once again, can be quite a few years before we hit menopause, what happens is that progesterone now starts to decline. So its primary role in the reproductive process was to hold that egg in place for the term of a pregnancy. It's a key part of that ovulatory process and a key part of a libido, okay? So really important part of the process. We no longer require that because the time for reproduction is coming to an end. So the progesterone is slowly declining throughout the perimenopausal years. And that in and of itself is one of the key factors for why we experience certain symptoms at that point in time. The other thing that's happening is our beautiful ovaries that have been there producing the eggs throughout the reproductive years. I actually say that they're putting on a bit of a fireworks display, okay? They're reminding us how absolutely awesome they were during those reproductive years and producing all of these eggs for us. So what happens at that time, the estrogen starts to fluctuate. So our estrogen goes up and down until it finally hits the lower level that is the menopausal estrogen production, okay? It's the fluctuations in that estrogen during the perimenopausal time that cause a whole bunch of other symptoms that we experience. Then there's other symptoms that are actually due to the differential between the estrogen and the progesterone. So if you actually sort of think about it, that progesterone's going down and at times where the estrogen's up. It's actually the difference that's bringing about a whole bunch of stuff as well. So it's really interesting to hone in on what's actually going on in your body at that point in time, because there's a different combination of hormonal imbalances that can be driving what's going on for you. And that means that we can target exactly what's going on in your body. So I don't know if you're anything like me and you're on Instagram and you're on Facebook, there is a whole world of hormonal stuff that pops up. I think that my phone sniffs how old I am or whatever part of the process is that I'm going through. But you know, all of a sudden there's all these hormone things that do pop up in my ads and everything like that. It is always really important to remember that they're very general, and what we do here is that we target, so we're actually being very specific about what we prescribe. So I'm pretty passionate about that as well. So when we actually have a look at estrogen, obviously during the reproductive process, it was important for developments at puberty. It stimulates the growth in the uterine wall, and it's a key role in the menstrual cycle. What is really, really important for us all to understand as women is that it has a whole bunch of other roles in the body, and these are the ones that are very important during perimenopause, menopause, and especially postmenopause. It's crucial for bone formation. So one of the things that we're often faced with at this point in time is potentially a recommended bone density scan. There's a reason for that, because at this point in time we want to look at how good our bones are. Estrogen is vital for bone health. I am an advocate for not waiting for the postmenopausal bone density scan. Let's have a look at how things are going now. Let's make sure I'm producing enough estrogen now. Because it's not about saying goodbye to that hormone. It's about making sure that we've got good amounts of that going on during menopause and beyond. It's crucial for brain health. So one of the big symptoms that happens during perimenopause, and for some people at menopause and postmenopause, if they haven't managed their estrogen very well, is brain fog, poor memory, really, struggling concentration. I see women who, have been absolutely amazing at multitasking and managing about 47 different things, plus the kids, plus the hubby, plus everything else that's going on. All of a sudden, I can't remember where I parked the car. And I've been through that myself. It's like this whole brain glitch. What's actually happening at that point in time was our brains, our beautiful women's brains, have been used to using estrogen for fuel. And then as the estrogen drops at certain points in time and eventually lands in a lower place, this brain is now looking for another fuel source. It needs to adapt to that. It's a transitional time. And kids and guys, they don't use the same abundant amounts of estrogen for brain fuel, okay? So it's just a matter of our brains adapting during this time. But it's very real that people will get the brain fog, the poor concentration, the poor memory. Estrogen is absolutely vital for brain health, okay? So it's important for bone health, brain health. The other one is cardiovascular health. Okay, it is really, really important for cardiovascular health. And even in our 50s, there's a big incidence of women experiencing cardiovascular issues. And so another reason why it's really important that we get on top of that during our perimenopausal years. It also helps our body utilize serotonin, which is that feel-good hormone. So a little bit of the flat feeling that might come with perimenopause, menopause and beyond, is very much connected to utilising that estrogen, okay? It has a whole bunch of other roles in the body. It's actually a fascinating hormone. It helps to regulate insulin. So one of the other contributors towards menopausal weight gain that some people go through is a spike or an increase in insulin resistance. So it's actually because that estrogen isn't there to regulate the insulin anymore. So it's a really important hormone beyond the reproductive process, okay? And one that we really want to manage. So as our ovaries have now, or they're heading towards retirement in the perimenopausal years, those ovaries are heading towards their retirement. They're putting on that fireworks display to remind us how good they were. We're now relying on other glands in the body to at least produce some levels of estrogen. One of those glands, or two of those glands, are actually our adrenal glands, okay? So if we actually have a little think about that cascade of potentially being stressed and the adrenal glands having worked a little bit overtime leading up to perimenopause, they might not be as cooperative during this process about helping us with the future production of estrogen. So it's really, really important that we actually get on top of a whole bunch of things at this point in time so that we know we've got this production of estrogen in the future. Progesterone itself, I call that estrogen's partner in crime, because when those two are balanced, we feel awesome. When they're not balanced is when we don't feel quite fantastic. And we get that imbalance if we get PMS before our bleed, okay? If we get headaches, all skin breakouts, a lot of that is the imbalance in progesterone and estrogen. This one's crucial for, obviously it was there for the ovulation during that process and holding that egg in place during a pregnancy, but it's also really important for healthy brain function. It has such a calming effect on the body. So that the progesterone that's now declining during our perimenopausal years starts to bring about, or can bring about, a bit of anxiety, a bit of flightiness, even some heart palpitations. Lack of restful sleep, the insomnia, I'm waking up a little bit more, not quite getting that good sleep. Doesn't help for energy when that's happening, okay? So it has a very calming effect on the thyroid. The thyroid is a really important gland that regulates our metabolism, our natural levels of energy, and our temperature regulation. So it is connected, like estrogen, to a whole bunch of other functions in the body. So really important that we have a little look at what's going on and, if we can, support as much production of that as we can as we lead up to menopause. So this is graphically a little bit of a picture of what's happening with the hormones. So if we can see in childhood, we have those, there's no estradiol and there's no progesterone. And then as we get into our teens, the estradiol really spikes up and the body's working to make that progesterone. And then in our reproductive years, we have all these high levels of both of those hormones going on. And then we get to the perimenopause, and you can see in the red, that's the fluctuations of the estrogen. And then the progesterone, the blue, is starting to bottom out. And that's where we land. But just note there in menopause that the estradiol is still in existence, okay? It doesn't completely flatten out. We still have estrogen, and that's what's really important for those other health factors. So if we experience the symptoms during perimenopause, I do need to reassure you that they're temporary, okay? There's ways of balancing them and getting on top of them. They can feel a little bit scary. I have had women in tears in my room thinking that this could be the onset of dementia or, you know, something really quite serious, because not only did they not remember their car, they forgot the child's first name. You know, like it's a horrible sort of feeling, especially if there is, you know, things in the family. So it's an important thing to address. So it can be quite scary. So it's important to remember, okay, these things are temporary. We can get on top of this. This is a bit of a red flag, to do something about it now. Okay, so we might find that at this point in time we're not coping as well with stress. Okay, all of a sudden hubby's a little bit more irritating, or the kids are just giving me the whoops. So we're not as on top of things as we once were. So it's that recalibration of the nervous system that's really important when it comes to managing our moods and managing our sleep. So these are all the symptoms, and we may be experiencing some, none, and everyone gets them to different degrees, okay? For some people, they're really severe. Some people, they're a little bit. Some people, I've got a bit of that, or I've got all of the above, okay? But some things you might be a little bit surprised to know are connected to hormones. So energy is really important. So that's probably one of the most common things that I see is there's a really intense level of fatigue. It's gone beyond tired. It's gone beyond give me a bit of magnesium and some vitamin Bs. It's the aeroplane is just not getting off the tarmac. It's really, really tired. The periods start to change. Our bleeds can start to change. So they might start to become irregular. They get heavier or lighter. They can be a little bit more painful. So lots of women that I speak to have had a reasonably stress-free cycle for many years. Not everyone has, but all of a sudden, they're quite heavy, they're quite intense, they're quite debilitating. That's uncomfortable. We talked about the brain fog, the poor memory, and that low concentration. Very, very real. Weight gain is probably the trickiest one for many. Like I was saying before, estrogen is really important to regulate insulin. Progesterone is important for the thyroid, at calming that thyroid, who is responsible for metabolism. So when you think about it, we've got all these little factors at play when it comes to perimenopausal weight gain. And so it's a matter of finding what the cause is for that particular person so that we can target that. Some things that often happen is that often people will say, okay, it's the gain in weight that's actually causing the insulin resistance. So you need to lose weight in order to get on top of the insulin. And yet that's actually what's driving it. So it can become a very vicious cycle. And that's why a lot of women at this time will say, I've done everything. I'm eating a lettuce leaf for lunch. I've done 4 sessions at the gym and I think I've actually put on weight today. So really, really deflating and really frustrating time when it comes to that. But there's a way to actually get to the cause and move on from it. Hair loss, people experience hair loss, dry skin, breast tenderness. The PMS might become worse. And for some people that can become really quite extreme when it comes to the anxiety and the flat that comes before our bleed. It can become really extreme for some, or just a bit more elevated than what it might have been for you in the past. The good old hot flashes, we've always heard about those, but that's actually the estrogen dropping. So that's a real thing. The insomnia, vaginal dryness, that can actually start in the perimenopausal phase. So estrogen is really important for our tissues and for the moisture of those tissues. Okay, so the vaginal dryness comes about and can become more of an issue at menopause and then post-menopause. However, for some, it really starts to kick in during perimenopause. For many, what happens is that libido starts to disappear. So fly out the window, non-existent for some. Okay, that's a really important thing for a lot of women to want to be able to get on top of, because it's like, where did that go? It just went. So it's often really nice and reassuring where you see it actually. It's one of the things that people get very excited about when it comes back. And they sort of come back and say, hubby said to say thank you. We're back on deck. So really important. So the flatness or the anxiety and the irritability that comes with that. So there's another little hormone at play here, which I'll explain a little bit more when I talk about the testing, and that's actually testosterone. So testosterone is, we often think about it as a male hormone. We have amounts of testosterone in our body. They're a really important part of the whole picture. It's not our dominant hormone. Now, when we think back to these fluctuations that are happening with the estrogen and the progesterone, and these guys are starting to dissipate a little bit, testosterone hasn't really changed. So I liken it to having a band, okay? I want a lead singer and I want a lead guitarist, and then I want my drummer, and I call testosterone the drummer. So the lead guitarist and the lead singer are no longer coming out on stage together all the time, okay? They're going through for some issues, but the drummer gets out there and he's still on stage doing his drum solo. And no one really wants to listen to the drum solo for a long period of time. That's the irritability, okay? That's testosterone. He's now flying solo, or he's not working with the other hormones. He's not converting to estrogen now. He's actually doing his little drum solo out there. And that's where the irritability comes from. Sugar cravings. Anyone get any of those delightful chin hairs? And people can even get excess hair on their chest or their back, which is a little bit embarrassing for a woman. But any of those stubborn chin hairs that pop up at this time, where you really got to get the tweezers and give them a good pull, that's actually the testosterone. So you can actually tag a lot of these things to the actual hormones. Cholesterol changes. Estrogen is vital for helping to manage our lipids, okay? So that's actually a really important part of that ongoing health process. So you can actually see an increase in sometimes the triglycerides and the LDL cholesterol at this point in time. It's all very much connected. Headaches or migraines. Now for some they actually go away, which is really interesting. So some might have had a lot of hormonal headaches throughout their journey, and then as they hit perimenopause they start to dissipate. For some they jump up and they come into the picture. Thyroid problems, which I spoke about before, very much connected to that. Metabolism, natural levels of energy. So when we're talking about fatigue, we've got to find out what's driving that fatigue, what's driving that low energy, and temperature regulation as well. So not only have we got the hot flashes there, but we could be getting a little bit warm because the thyroid's out of whack as well. Or we could be getting really cold. So for some people, the hands and feet are really cold, and yet the rest of us is boiling up like a furnace. Bizarre feeling, but it happens. Allergies. So for some people at this time, allergies pop up. Never had it before, never used to get hay fever, never used to have sinus reactions. Estrogen actually helps to regulate our histamine. It's fascinating once you actually work out how much these hormones do. They're really, really important. UTIs, so urinary tract infections, can become a little bit more common around this time, as can frequency with urination. All of a sudden we're running to the toilet a little bit more, and we can even feel like we haven't quite cleared when we've done that, because about 2 minutes later I'm going back for another wee. So, and leakage is very real for some as well, and often embarrassing and uncomfortable to talk about, but very much connected to the changes in hormones at this time. Aches and pains, so some body aches and pains. I see a lot of women who get a lot of pain in their feet, really painful feet. Sometimes, diagnosed with plantar fasciitis, and yet when their hormones come under control, all of a sudden the pain goes away. So very much connected to the tissues and the bones. But when we do have hormonal balance, there's all the good things that come with that. So lots more energy, less stress and anxiety, the moods are better, we're thinking clearer again. Becomes easy to manage those periods, even though they might start to disappear on certain months because they're going to start going away altogether. It becomes easier to manage them when they're there. Clearer skin, healthy hair, who doesn't want that? We're getting a little bit paranoid about everything that's going on at this time. And a really nice rejuvenating sleep at night time. So, testing our hormones. So what I do here, what we do here at Remede, is we're very passionate about testing. So every woman in this room is going to have a different level of hormonal balance at this point in time. So finding out where you're at is what's important, and what's important to me, because what your symptom is might actually be, being driven by a whole different range of issues, okay? Are we craving the sugar and carbs because that testosterone, the drummer, is out on stage doing his drum solo? Or is it because the insulin resistance is a bit out of whack at the moment? Or are you running really high levels of cortisol, so your body thinks it's running from a saber-toothed tiger, and you're just craving sugars and carbs to fuel your muscles? It can be a whole different range of reasons for every different person. So the testing becomes quite valuable. Now, I hope that you can see this one okay. It's a little bit of an example of the testing that I use. So for me, the gold standard is to use urinary hormone testing. It's an advanced level of testing that not only tests your active hormones, so it'll look at your active levels of estrogen, your estradiol, your estrone, and your estriol, but what it does also look at, and that's all these figures here, which become really important to me, is how you're metabolizing those hormones. Now, metabolizing those hormones is a very important part of the process and an important indicator of your health. So hormones in their active form are not water soluble. They need to be converted in order to be, so that's the metabolizing process, and then leave the body. It's just as important to make a hormone as it is to clear that hormone from your body. So what I'm talking about here is minimizing the risks of estrogen-driven cancers, okay? So if we're circulating a lot of these converted hormones around our body, we're actually increasing our risks at certain points in time. So it's just as important part of the process to clear the hormone as it is to make the hormone in the first place, if that makes any sense. So that's why I go to this extent when I look at testing of hormones. Same thing with progesterones, okay? And this is a fairly typical picture for a lot of women at this point in time. They're looking at fairly low progesterone levels to start with, okay? So, and that can come from a lot of stress, And so the progesterone levels are low at the beginning of the perimenopausal process, and then they're going into decline. So it makes that time period a little bit more of a struggle. So if there's anything we can do to bank some progesterone to help with our body's health, that's why I encourage natural cycles. If you can cycle have as many cycles naturally as possible leading up to menopause, you will actually bank some of the benefits of these hormones leading into that place, okay? Androgens, so our adrenal hormones, you can see Mr. Testosterone there he is. Quite a common sort of picture of him flying high on his own there. But these other adrenal hormones are a very important part of the process. They're building blocks. They actually help to create our hormones. They help to synthesize our hormones. They actually get them to work together. So they're a really, really important part of the process. And then knowing where these come from. So vitamin D, for example, is important for androstenedione. So a lot of ladies with low vitamin D levels will simply not be producing that hormone. So that's about the whole sort of Sherlock Holmes part of the process and finding out what's going on, what's causing the problem. And then this is the fun one, and this is often something that people probably don't want to look at, is where my cortisol levels are at different times of the day. So the testing that I do uses, actually assesses where your hormones are at 4 times throughout the day, not just at one point. So mid-morning, mid-morning, evening, and then nighttime. Cortisol levels are fascinating, and finding out if your cortisol levels are spiking. For example, they might be spiking at nighttime. You've got no chance of a restful sleep, okay? Now to complement that, where are your melatonin levels at, okay? This test also has a look at where your melatonin levels are at. Obviously we want melatonin to be quite substantial at this point in time. We want to go to sleep, and I don't want crazy high levels of cortisol. So be blown away by how many results I see where the cortisol's really high at that point in time at the end of the day, and we're simply not producing that melatonin for a restful sleep. Melatonin is a very protective hormone in so many other ways. It's not just a sleep hormone. It's a bit like estrogen. It is very protective for many of the organs in the body. It's a really key part of the immune system. So, it's just as important to produce melatonin for other reasons as well as sleep. So getting those guys right means that we can get that circadian rhythm right, and we're halfway there on the journey to actually having some beautiful restful energy. So a great test to do. If you're looking at testing hormones, I encourage you to look for a practitioner who can actually do this thoroughly, okay? Because there's a lot to see. Blood tests. So I mentioned at the beginning that this is a very insightful time. It's a really important time to look at everything that's going on in the body and set yourself up for not just overcoming all of those symptoms that we talked about before, but setting yourself up for ongoing awesome health, okay? We want to look after the brain. We want to look after the cardiovascular system. We want to look after the bones in particular. This is the time to do it. So blood tests that can complement the hormone tests. If you can, and I encourage you to work with your doctor where you can, have a look at as many of these, okay? So look at that insulin and glucose that we spoke about before. Thyroid functions in detail, and that goes beyond a TSH. And I can talk about the thyroid in detail at another time, but really important time to look at that. Autoimmune markers. Inactive thyroid hormones. Vitamin D and vitamin B12, your liver function, your full blood count, get a look at your immune system. How's those red blood cells transporting energy around your body, okay? They can all be a little bit deficient. Copper is a really important factor when it comes to dysregulated estrogen, so that's another thing that we can look at is your minerals. Zinc, iron, and of course those lipids. Good time to get what I call the 100-kilometre service and check, So gut testing. So we look quite deep into the whole gut environment here. So we look at the whole microbiome. When it comes to gut health and its relationship to hormones in particular, so intestinal permeability, some people might call it leaky gut, but intestinal permeability and other gut imbalances have a big impact on our hormones, okay? One of the main things that comes with dysbiosis, which is that imbalance of good bacteria and bad bacteria, is it means that we can actually create bad estrogen. So we're creating inactive sort of what we call negative forms of estrogen, and then our body thinks that we've got enough floating around in the system, and then it stops making the good estrogen that we want, okay? So it's a really important part of that. Obviously, really key to producing the neurotransmitters that we want. And pathogens in the gut can then impact our detoxification pathways. Now, the detoxification pathways are crucial when it comes to that metabolizing, especially of that estrogen that I was talking about before. So it's all sort of connected. So to do really, really comprehensive testing at this time, you'd also look at the gut, okay? There's genetic testing that can come along here. So if anyone's heard of the MTHFR gene, all right, that's poor methylation, but that's also associated with poor metabolism of estrogen. The COMP gene, again, associated with estrogen metabolizing, and the PEMT gene as well, okay? So for certain people, we would take the testing that far. Not always indicated, but can be important. So like I was saying before, such a critical window for health, not just for the cycle coming to an end, but the thyroid, the immune system, that cardiovascular system, the bones, metabolic system, and we talked about the blood testing. So in terms of the solutions, so at Remede here, we're an integrated practice, okay? So there's the naturopaths and the nutritionists like me, and we have integrated doctors, okay? And nurse practitioners as well. So we've got everyone here. So when it comes to solutions, we might already be familiar with the good old HRT of the 1990s, okay? And as many of us know, that this sort of came about with some other issues, and it's not really used anymore. The beauty is that these days we actually have what's called body identical hormones. And so the integrative doctors here are very supportive of that, and for some that is a great solution. So I'm a huge advocate of that, of the body identical hormones for some people. The other thing that I'm a huge advocate about is botanical hormone therapy. So instead of hormone replacement therapy, I call it botanical hormone therapy, and that's because I'm using plants. So I like using herbal medicine, and watching herbal medicine and what it can do to help regulate hormones and help a person get to optimal health is one of the most beautiful things, because you're using natural substances and you're not putting more estrogen. So for some people, they can't actually use even the body identical estrogen because they might have a family history of breast cancer, they might have a history of hormone-driven cancers themselves. That's simply not an option that's available to them. Using the plants is a lot safer. So we do a lot of botanical hormone therapy here, and it works beautifully. Nutrition is a really important part at this time. Okay, there are foods that can really complement your journey, really help your hormones to regulate, help you to produce more of certain hormones, help you to clear those hormones as well. So much of it can be done in the foods that you eat, okay? So there's a lot of phytoestrogenic foods, so such as broccoli, soy, which is a little bit, you have a question mark, and a lot of people do have the question marks over soy, and that's very much an individual case scenario when I talk to people. It's not off the table for everyone, it's also not on the table for everyone as well. Legumes, linseeds are fantastic, so flax seeds are really good, and alfalfa. So other important foods like your almonds and your apples, brewer's juice is fantastic, your beetroots. So many your veggies, just think fruits and veggies, eat plants. They're just wonderful for hormone production. And seeds. Seeds are also really good. You can actually help your cycle just by using seeds, actually by cycling seeds throughout a natural cycle. They're very helpful. Dietary fibre. So, you know, I really, this is not the time, and I'm not here to sort of bag certain diets and not do certain diets, but this is possibly not the time for everyone to be on something like a keto diet, okay? There are many food groups that need to be included at this time, so it's important not to get too extreme. And some people get really frustrated with the weight loss, or, you know, the weight gain rather, and then go quite extreme with their nutrition. I really, really encourage you to think about that future base of health as well. We can get to the bottom of what might be driving your particular weight gain, but this is a process that your body needs to go through, and I would rather be looking after your brain, your heart, and your bones than just being blinded about losing weight so I can be a size 6 again. Okay, it's really important to get that balance in place. It's about overall health. So yeah, really be careful with the extreme diets at this point in time. Bitter foods such as chicory, rocket, I love rocket, really important for liver function. We want to optimize all of those detoxification pathways at this point in time so that we can metabolize those hormones. We want to keep our risk factors down. And obviously our saturated fats. Dairy foods are really a no-go. I encourage you to cut the milk, cut the yellow cheese, cheese is so sad, isn't it? I love cheese. But not the best time for us to be eating that, ladies. Not the best time for us to be drinking alcohol, so if we can moderate that as much as we can. It does go a long way to smoothing out this process. Don't worry, once you hit menopause, it's fine. We can pick it all back up again. But it is a tricky time. So good fats. So all of those good fish, the nuts, the avocados, the coconut oils, olive oils. Yeah, again with the dairy foods. The refined carbohydrates, stay away from, but we still need to get some of the good ones in there as well. And when I say good ones, you know, sweet potatoes are great. There's lots of good options, just the refined white ones we want to keep out of it. But don't be scared about having a piece of sourdough with some avocado and eggs on the weekend as a treat, because it's okay in moderation. But obviously lots of plants again. Plants, nuts and seeds. So in terms of solution, I touched on a couple of those before. Getting a really personalised nutrition plan can be really helpful. So actually getting someone to work with how you eat now, you know, where are the little areas that are possibly your downfall. So there are certain times in the day, or there's certain foods that just you are absolutely craving. So really get on top of that nutrition plan, and then and don't worry, it's not well, the way I work anyway, it's not extreme. You know, I have a family myself. There's other people to feed in the household. So, you know, it's really about getting something that works for everyone that you're with at that point in time, but just making sure that you're getting the goodness that you need for your body. It has roll-on benefits for everyone else, so don't worry about that. Addressing nutritional deficiencies, so if there's a lower level of zinc, if there's a lower level of magnesium, vitamin D, that really important one, if that's down on the low side, that's going to impact some of those androgens. They're building blocks for future hormones. So this is the time to address that. We don't want to ignore it. Iodine is really important for hormone balance, okay? We don't get a lot of iodine, so unless you're you know, eating lots of seaweed and things like that, there's not a lot of iodine in our diet naturally. Adrenal support. So I talked before a little bit about those cortisol levels, really looking after the adrenals, the stress side of things at this point in time. If that's been a journey leading up to perimenopause, then I would actually say to each and every one of you, that's the number one to address now. Okay, it's time to look after you. It's time to have a look at the areas in your life that might have been causing that stress or might still be causing that stress, and look at the measures that we can put in place to get those cortisol levels down. it's absolute priority number one. You'll be really struggling to get everything else on track if you don't get that one on track first. So, and look, life is life. I'm a realist as well, and I go through stress too. So it's doing it in a way that works with your life. It might be going for a walk. It might be, getting to that yoga class that you used to love to do and you've been really busy and you haven't been there, Pilates or anything like that. Anything that might be able to be introduced that fits in with your world to create a little bit more balance. Priority number one. Integrative medicine. So like I said before, it's not just people like me here, it's not just the naturopaths and the nutritionists. We have integrative doctors here as well who are absolute magicians. So this is the time when you want to get your tribe together in terms of support, okay? There is a lot of amazing professional advice around, and there are doctors who are willing to be open-minded and work with what I do, what you might be doing elsewhere, what other measures you might need to have in place as part of your health plan. So really get that tribe in place and actually look at that integrative medicine. Like I was saying before, the body identical hormones might be the preferred solution for you, and they might give you, a lot of support during this time. So that's where a great GP will come in. The gut balance that I mentioned before, and of course my favourite being the botanical hormone therapy. So we can get those herbs out and get some very special formulations that are specifically designed for you. So, any questions, anyone, or anything I didn't cover that was burning in your brain?
Can I just ask about the blood test?
Sure.
Does that refer to like a live one or either?
We do the live blood screening here as well. The one I was referring to there is actually the pathology collection, and getting the results from that. So when I get all the results together from everyone's testing, so we have a bit of the boardroom meeting going on, and we have a look at everything and put it all into place. Yeah. And some people, when they see me, they've already had some of those done recently, so we get copies of those and top up where we need to. So we do see the patient separately, but we collaborate where required. So so I work very closely with, for example, Dr. Hazel here, and she is a specialist in women's hormones as well. So if you're going to see one after the other, then we're with your permission, of course, happy to liaise and pass over the information that we have. So we'll look at the same test results, the same notes, so that you don't have to go through the whole process again. Yes, you can tell. So even with the Mirena in place, we will get good readings on here. And that's actually taken into account, so you can still have a look at what your hormones are doing at that tissue, at the urinary level. And yes, we can actually distinguish between what is postpartum and perimenopause. And I do find that, especially given that we take into account that for some, and it is a smaller group of people, but it could be up to 15 years before that the perimenopausal process starts, that it can be not long after a postpartum if we've had a baby a little bit later in the process as well. So it can be a fine line, but we can distinguish between the two. And at the end of the day, it's getting that hormonal balance for you. Even if it doesn't have that distinct label attached to it, it's getting that balance and that stability. When it comes to hormones, we really want stable, we want boring. That is the fireworks display that's causing the chaos. So, it's absolutely possible. Okay. And if anyone doesn't have any other questions, thank you for coming tonight. If you do want any other information, you know where I am. And we have many amazing practitioners here as well. So, if I'm a little bit too kooky for you, there's lots of other great practitioners practitioners here too, and that I can recommend for you. So a couple of my other colleagues, Renee and Caroline especially, are very good with hormonal support. So, and as I say, Dr. Hazel is an amazing GP here. Some of us have a little bit of a wait time, but we'll work with you. We'll get you in. Yeah, for sure. Okay. Thanks for coming tonight. Thank you.